Hi everyone, welcome to this episode. And in this episode, we're going to be speaking to Sophie Medlin, who's a consultant colorectal dietitian. And we'll talk about things such as your relationship with food in terms of how it can support your gut health, how dieting, dieting, common fad diets can actually negatively affect your microbiome, how mental health can affect your microbiome, how your gut health can affect your mental state, and how your mental state can also affect your gut health, and so many things. We're also going to be just talking about stomas. We're essentially going to be talking about poop, in long story short. So without further ado, let's get straight to the podcast. Hey guys, welcome to the Binge Dietitian podcast, and today we're going to be introducing once again Sophie Medlin, consultant colorectal dietitian. But I'd just like you to introduce, because you probably know much more about yourself. So how about you introduce yourself to us, Sophie?
Thank you, Jonathan. Thanks for having me back. So yeah, I'm Sophie. I call myself a consultant colorectal dietitian, and my friend very recently said that's what I'm talking about when I say colorectal means that I work in butts and guts, which I think is great, and I'm going to try and use that somewhere. So essentially, I spend my whole career talking about poo to people clinically. I've been a dietitian for 17 years, so a long time. I worked in the NHS for 7 or 8 years before I moved into academia. So I was a lecturer and researcher for 5 years, most recently at King's College in London, where I still do a lot of lecturing. I then set up my clinic business, which is City Dietitians, and we've got a team of dietitians, all with different clinical specialities, who look after people with all sorts of different medical conditions. I also develop products for the industry, so probiotic, vitamin products, functional foods, all kinds of different things, both in terms of the formulation of those products, but also the marketing messaging and how to get it right and how not to mislead consumers and things like that. And I also have the pleasure of doing some TV work. So I've most recently, this time last year, was in a show on Channel 4 called Know Your Shit, which was talking about gut health, obviously, and that's all still available on 4OD, so on the Channel 4 player. And yeah, I do lots of other bits of media work here and there, podcasts like this and other podcasts, big podcasts and all sorts of different things, radio work and other bits of TV work, lots of different stuff. Keeps me busy, Jonathan. That's the main thing.
Oh, absolutely. Yeah. I actually saw Know Your Shit probably like, well, actually, I think if I could remember, last year, you said it was in the works and is going to be released like 2 weeks after we did the podcast and everything. So I watched it. It was really, really good. And
Thank you.
as dietitians, I think it's quite common knowledge for us. For example, like the treatment, quote unquote, for constipation. For other people, it's like, oh, I don't know how to overcome constipation. There was a patient, I think you'd call it a patient in the TV show, where someone just came in with chronic constipation, and then you just talked about flaxseed, a flaxseed concoction with yogurt, if I could remember.
Yeah.
Or was it like
Like
water or
chia
something?
seeds, that kind of stuff, kiwis, the basics, drinking more water.
Yeah, kiwis with hair,
Yeah,
actually,
yeah.
because people would go like, "What? There's no way I'd eat the hair and everything."
Yeah,
Yeah.
it's fine. It's fine. And actually, those simple things solve problems for people. And I think one of the things with the show is just actually helping people to understand that they have got a problem, because actually lots of people live with chronic gut symptoms that are completely treatable. And because we don't talk about how often we should poo and like what it's supposed to feel like and how it's supposed to be, people don't know that they're struggling and could feel better, I guess.
And why do you think people don't really want to talk about their poo and everything?
Well, I think it's still a bit of a taboo, isn't it? I think people are
Yeah.
still very private about it, which I understand. Nobody wants to no one wants to be watched pooing, for example, but ultimately it's about just trying to normalize it so that when people have a problem, they don't feel embarrassed. I think one of the things when I was working in the NHS in particular, and even
Mm,
now, people suffer with their bowel problems for 20, 30 years. We had patients
mm,
turning up to hospital with tumors the size of grapefruits that would have been painful and bleeding for years before they presented because they were too embarrassed to come forward. Whereas I think when we can bring these things into the public eye and make people feel it's normal to talk to your
mm.
doctor and to people about this sort of stuff and it's nothing to be ashamed of, it reduces stigma, which brings people forward when they have problems and gets people the help they need, rather than it being kind of behind closed doors in a private and something that people feel really embarrassed about.
Absolutely. I actually had a, I shouldn't be laughing, but I had a friend who actually asked me, "Oh, Jonathan, like I'm farting like 5 times a day. How can I reduce the amount of times I fart? Because I think farting is a way of your body telling you that you're not really absorbing things really well and it's going out of your system." And I said, "But farting is normal. Have you ever got what is the craziest or one of the most interesting things you've got from patients or clinics?"
Oh, all sorts of things. I think I mean, I don't want to embarrass anybody, obviously, but there are things that people are
We're all
doing
open.
that are, normalized and they live with that they really shouldn't live with. I suppose there's the kind of extreme end of that spectrum, which is people having fecal incontinence, so passing stool without meaning to, pooing their pants is how we would call it
Mm.
colloquially, and just being told by the GP, there's nothing we can do for you, which isn't the case. And then there's people who are having to do what we call manual evacuation, where they're having to put their fingers in their bottom to help them to pass stool, which is happening far more commonly than people might realize. And it's not something
Mm.
people should have to live with. We've noticed a big peak in people coming forward from through the menopause and having problems with their pelvic floor, both urinary and passing stool. We have big problems with people thinking that they've got regular constipation when really they've got pelvic floor problems and rectal problems. I see a
Mm.
lot of hemorrhoids and piles and fissures and all these kinds of things that people, don't want to talk about, but are super, super common and people are struggling. So yeah, I mean, I find it tricky, Jonathan, if I'm honest.
Mm.
The people who come to my clinic who say, "Oh, I get a bit bloated on a Thursday when I eat this," and I'm like, I don't really care. I'd much rather look after people who are, really sick and really struggling. And it's quite an interesting
Yeah.
juxtaposition in clinics for me sometimes, where someone's like, "Oh, I think I'm farting too often," and it's like 5 times a day. And then there's somebody, the next person's got IBD and they've just got out of hospital and they're really sick. It's a real juxtaposition between what people are worried
Absolutely.
about. But bloating, gas, fairly normal. If it's uncomfortable, if it's causing you pain, we can sort it out. If it's really smelly, we can sort it out and we can make it better
Mm.
for you. It's completely normal to fart up to 20 times a day. Nothing wrong with you.
Yeah, and just on the topic, what are some common red flags would you say? Because with the people in this podcast, or most of the people in this podcast, they struggle with binge eating. But today we're going to be talking about how dieting, fad dieting, can relate to like poor gut health and all
Yeah.
these kinds of gut-related issues. So, what are some red flags would you say to know that like maybe in terms of your bowels, in terms of your abdo pain, bloating, how bad does it have to be to seek help from a dietitian?
Yeah, good question. I mean, genuinely, having said what I've just said, anything that's bothering you, get some help for it. Don't just live with it and think, oh, maybe there's something wrong with me and be worried. Go to your GP, see a dietitian, because we're here to help and we can solve most problems. I think, the red flags in terms of colorectal cancers would be things like blood when you go for a poo. And
Mm.
unfortunately, colorectal cancers are increasing in numbers in younger people. So even if you're young and you think, oh, I can't have colorectal cancer, go and get a test anyway from your GP because it's really important. If you've got a swelling in your tummy that doesn't go away, so like a lump in your lower tummy, get that checked out always. If you have what we call a
Mm.
change in bowel habit, so for more than 2 weeks, your stool changes from being loose to being too hard or too hard to looser, or anything that's different for you, go to your GP if it's lasted for more than 2 weeks and make sure you get some tests done. And of course, abdominal pain isn't normal to live with, and you don't have to live with that. If you've got mucus in your poo, you don't have to live with that. And if you've got bloating that's painful and it doesn't go down when you've been for a poo, then that's something also to get checked out because that can be a gynae issue, for example.
Mm-hmm. Yeah. Okay. Those common red flags.
Yeah.
It's interesting that some GPs don't really pick up on it. Um, from an NHS setting, because I work part with NHS as well. Actually, as a colorectal dietitian, to name
Oh, nice.
one of them, actually, yeah. So some GPs, they recommend for IBS just simply like mindfulness, but then there's a patient who has like IBS-D for very chronically, or IBS-C constipation for many years, but they just go mindfulness, and sure it does
Yeah.
help, but it's
Or they
not.
tell them to Google the low FODMAP diet, and that's also really unhelpful,
Oh, that
isn't
you
it?
get that every single time, like low fat diet, low fat diet. Yeah, that's terrible. Do you get that a lot?
Yeah, I mean, I see lots of patients. I mean, I guess I'm often the last port of call for people. People will have often seen lots of different people before they come to me, and then they eventually get recommended to come and see me because they have seen lots of other people that haven't been able to help them. And so I see patients who have probably done every test under the sun, tried every supplement out there going, and maybe had advice from several different people before they end up with me. And very often, more often than I would like to admit, maybe people have seen lots of different people, but they end up where it ends up that there's a very obvious problem that's not necessarily IBS, for example.
Mm.
So I send patients back to their GPs for more testing. Either it's a fecal calprotectin or a switch test for inflammation in the bowel, or it
Mm.
might be a H. pylori test testing for problems with bacteria in the stomach. Sometimes it's a fit test, which tests for bowel cancer. And quite often it's actually something like bile acid malabsorption, which is quite
Okay.
common after you've had gallbladder surgery, which is a common operation,
Mm,
or it can just be something that happens from an idiopathic perspective. It just happens for one of those reasons, for a
mm,
reason you don't really understand. And so, yeah, I think GPs are doing their best. Lord knows the NHS is on its knees and everyone is trying their best. But I think GPs really need some more education around colorectal conditions and common colorectal conditions so they can signpost people appropriately, because, living with chronic piles, living with fissures, it's not something people have to live with. And there are
mm.
certain signs like having grease in your poo or urgent diarrhea, those kinds of things that actually is not part of the IBS picture, but it's kind of all grouped together and they go, you've just got IBS, go and calm down. And everybody knows that being told to calm down when you're stressed out is not
Yeah.
helpful. So yeah, I think we've got a lot of work to do in that area.
Yeah, absolutely, Sophie. And when these patients come to you, because it exhausted most options, how do they feel mentally? Like, what are they like mentally when they come to you? Are they motivated or are they quite like down?
Yeah, I would say mostly they're enormously motivated because they're just desperate for
Mm,
answers at this point. And
yeah.
one of the things that I find tricky is that when people have lived with their symptoms for maybe 20 or 30 years, the changes to the microbiome associated with that's probably the starting point of their condition a lot of the time, is so embedded, it takes a long
Yeah.
time to undo it. Whereas I
Mm,
also see a lot of patients who maybe have only had symptoms for 6 months or a year. I think that's much easier to undo. It's the long-term stuff. And alongside that long-term bowel problem comes the disordered eating, the complicated relationship with food, the mistrust of their body, the mistrust of everybody, because people have sold them all of the solutions over the years. And those patients, they struggle. They're a struggle to manage
mm.
because their things are so embedded, but they struggle more mentally, I think, than other patients.
Yeah. And what are the common common factors that you find when you're seeing patients? What are some disordered eating habits that might slowly pop up related to these gastro issues? What it's more like a chicken and egg scenario, if you could know what I mean.
So people, as you know, and as we know, there are a few foods that are really commonly demonized when people have bowel problems, things like dairy and gluten. And then people can end up
Mm-hmm.
being quite fearful of fruits and then some vegetables. And then people end up following a diet that's extremely restricted. That extremely restricted diet is going to further harm the microbiome, which is the root cause of lots of these problems. It's going to cause further harm to the microbiome. And it's all well and good me saying, well, you need to eat a varied diet. But if they do that, suddenly they are going to have symptoms because the
Mm-hmm.
bacteria that to help to digest dairy and the bacteria that help to digest gluten aren't present anymore because they've
Mm-hmm.
starved them off. So people do genuinely have more problems when they eat those foods. So it's a case of very carefully, with a lot of trust building and rapport building, and probably some good probiotics and maybe some prebiotics and things to support their gut, help people to really gradually reintroduce those foods. But the fear is real. And we work very closely with health psychologists and eating disorders psychologists because lots of these patients need help that's beyond my scope of practice. And that's patients who wouldn't identify as having an eating disorder and certainly wouldn't meet the criteria for an eating disorder, but they certainly have very disordered eating and a very complicated relationship with food as a result of their, which all started from having bowel problems.
Yeah. What is a typical day in the diet, typical diet in a day look like for someone who's struggling with the relationship with food, but also like let's say for example, IBS and they're following the FODMAP diet. What does it normally look like? What
Yeah,
are the common diets to jump onto?
so patients will just, so they won't have any gluten for breakfast. So very often breakfast is either skipped because they're trying to
Mm-hmm.
avoid having symptoms in the morning, or they'll have like a low FODMAP cereal, and then they might have a bit of oat milk or rice milk or something that's got very little nutrition in it at all. Sometimes they might have a bit of non-dairy yogurt, for example, which again, we're often missing out on first good nutrients, but also on probiotic bacteria and healthy balanced things there. Then lunchtime will usually be very tricky for them. They might have like a gluten-free wrap with some vegetables, some salady stuff that they feel safe with. And then, if you're lucky, you might get a bit of protein in there. And then the evening will be like rice or potatoes with
Mm.
chicken or fish and maybe vegetables if you're lucky. But most people, I mean, carrots and green beans are the ones that people generally feel fairly safe with. And that's, they're both low FODMAP, so I can understand why. And one of the things I see quite commonly, Jonathan, is that patients who potentially have followed the low FODMAP diet for years on the advice of a GP a long time ago and never been able to get back onto FODMAPs, or even, you know, they started with a dietitian but kind of didn't get to the reintroduction phase for whatever reason. Those patients sometimes binge on higher FODMAP foods, or they just go, actually, I can't do this today, and they cause themselves a lot of mental pain through that, but also, you know, real challenging physical symptoms. And unfortunately, that's something that I see quite commonly, is this sort of, I would call it the fuck it button, excuse my language.
Yes, no, absolutely.
Yeah, they just
It's
go,
true.
I can't do it today. I can't do this. And also they get to a point where they go, well, everything that I eat causes me symptoms, so I might as well eat whatever I want to. And then they get back to this huge restriction the following day or the following week. And I think a real telltale sign that your dietary management has gone really awry is if you've cut out loads of things but you still have bad symptoms. That means it's not working for you. Or if over every month you find yourself cutting other things out, that's a sign that it's not working for you. And we need to get to the bottom of it and fix it for you, rather than just this sort of taking foods out of your diet is actually making the root cause of your problem worse, which is a really important thing to try and understand and to try and work with people.
Yeah. And let's say like a patient, you're speaking to a patient who had all those issues. Where would you start with them?
Yeah, good question. So again, I think it's this trust building, it's the rapport building that's really important. And, you know, I'm lucky because I've got a public profile. So people generally, if they found me from a TV show or they found me from social media, they already know that I'm someone that's trustworthy. Lots of our patients come from consultant referrals as well, or from family referrals and things like that. So that's all really helpful in getting that trust piece in right at the beginning. I think then helping them to understand what my theory is about what's going on in their body and helping them to get to the root cause of it. So for me, I'll always say something like, well, there's three main reasons why people end up with what I would call a microbiome injury, which can lead to symptoms like yours. And I would say they are antibiotic use, a period of food poisoning, or a period of acute stress. Do you recognize any of those in the what started your symptoms? And 99.9% of the time they'll say, yes, I was super stressed, or yes, I had a load of antibiotics. And it might even be, were you a poorly baby? Did you have lots of antibiotics as a child? It might even go back that far for people. But it's trying to get to the root cause. And once we found the root cause, we can help to build on their knowledge and understanding, meeting them wherever they are, to help to educate them about how their gut is acting and why it's acting that way and what's going on and why the food restriction is making it better in that day, but making it worse in the long term. And that's not necessarily easy, or you know, it's not something that's particularly comfortable for lots of people, because they think they've got something really terribly wrong medically, and they do to a certain extent. Their microbiome's not working, but ultimately we can get it better, but it takes perseverance and time. And we use tools to help people to reintroduce things very gradually, rather than it being a feeling like they're being told, or just go and eat anything you want to because you're being silly. That's definitely never the message that we're giving people.
And I think with going back to like GPs, do you think it's like half and half, like their fault? Because they only have like literally just 15 minutes you can't like go through the relationship with food, help them increase awareness of their issue. All they can do is just point people towards, and it's just easy to point towards like no gluten diet, no dairy, no, just the low FODMAP diet, and then see ya.
Yeah, absolutely. You know, the thing is, the GPs don't have time, but equally they don't know. They're not taught anything about the microbiome or how to manage it, especially if they are, even if they qualified a couple of years ago, they probably weren't taught very much at all about the microbiome, the importance of it, and what's going on, or about IBS and the etiology of it and all that kind of stuff. So I really feel for GPs, because then it's not their job and it's not their role, and there's not enough dietitians and the waiting lists are too long, and all the problems that we are having with the NHS is just and now we have all these problems with commercial intolerance tests and commercial testing, things which I think we'll get into, which further muddy the waters and cause so much more harm than good.
Talk to us about Sophie, common intolerance tests. What are red flags? What is a validated intolerance test, if there is any?
Good. So there aren't any commercially available validated
mic drop.
There just isn't any. I've seen two kind of big rises recently. One is the like finger prick blood spot tests, and they say that they're looking for IgG reactions to foods, or an IgA reaction. I always get them confused. A reaction to food that's basically an immune reaction, a completely normal immune reaction to food. So whenever your body is presented with a food, you'll have this reaction in your blood, and they measure that and they tell you that you're intolerant to all the food that you're eating, and you have to cut everything out. And I had a patient who came with their test results quite recently, and she was like, oh, it told me I'm intolerant to pistachios, but I've been eating a lot of pistachios recently. And I'm like, yeah, it told me you're intolerant to them because it knows your body's responding to the pistachios you've been eating. It's not that all along you're not intolerant to them at all.
Yeah.
And then more recently, we've seen these hair intolerance tests coming up. I just did a video about them today, actually, Jonathan. And it's
Yeah, I
like,
saw.
yeah, they claim to use something called bioresonance testing, which is where they claim to be testing the energy field of your hair and how
Energy field.
energy field of your hair and how it responds to different foods. And on this website I looked at, they had a couple of videos linked to like physics. And I was like, what?
Oh,
This has nothing to do with what
physics.
you were saying, because bioresonance is physics, right? And then some nonsense about, papers that people have written, which is basically theoretical stuff. It's nothing published, not peer reviewed, not trials in humans. It's literally made up. And interestingly, the York test, which is a big supplier of intolerance tests, the finger blood ones, they were told probably not last year before now, so 2022, that they weren't allowed to claim to be intolerance tests anymore because there's no evidence that they can diagnose intolerances. And all they've done is put a little asterisk at the end of their thing, and you scroll down to the website and it says we can't diagnose food intolerance tests. And still more and more of this nonsense comes to the market.
Oh.
Hey.
So intolerance tests, that makes me want to move on to like a very, very hot topic right now. And you probably, I don't know, I can't remember if you made a video on a certain person, but let's talk about CGMs.
Yeah.
Because that's increased in popularity together, ironically, with Ozempic or semaglutide, although those kinds of drugs. What are your thoughts on continuous glucose monitors, tracking your glucose?
Yeah. So we've seen this. The thing that I find particularly frustrating with it is it's basically pathologizing or making something that's completely normal seem dangerous and something that needs fixing. So when people are pathologizing normal fluctuations in blood glucose in order to sell them a product or a hack that fixes it, I think we're in very dangerous ground. And of course, when someone's got diabetes or someone has a condition where their blood glucose is affected, then using CGM, continuous blood glucose monitoring, is helpful. In healthy people, it will make you believe that eating a stick of butter is better for you than eating an apple, because your blood glucose won't rise when you eat a stick of butter, but it will when you eat an apple. And of course, I'm being extremist, but ultimately there are lots of examples of that you could use. Fried chicken is another one. It won't give you such a big glucose reaction than a banana will. It's certainly not better for you. And it causes a huge amount of confusion to people. And I think the blood glucose monitors being sold alongside microbiome tests, your microbiome test will tell you to eat more whole grains, and your CGM will tell you whenever you eat whole grains, your blood sugar rises. And people are more confused than ever. And they turn up to me with these huge PDFs of information, and they don't know what to do, and nobody knows what to do with all that information. I think with CGM, if you're doing it in parallel with a registered healthcare professional with a legitimate reason for doing it, and they can help you to interpret those results, fine. I think if you're doing it off your own back and just going, oh, that's interesting, and thinking that your things are dangerous for you, it's really risky. And certainly in the content that I have posted about continuous blood glucose monitoring, patients have said, I did this for a while and now my eating disorders come back with a vengeance. I can't stop thinking about it. And it's really scary stuff, and it's the last thing that people should be doing, especially if they've got any sort of complications in their relationship with food, which arguably almost everybody does.
Yeah, there was a video about well, I don't know if you want me to like mention any names.
Okay,
Tim Spector, he did a podcast with someone and he was talking about the benefits of continuous glucose monitors, and then only like many people were trying to like bring him down. And there's also a similar video where he recommended, also not related to CGMs, but he recommended Coke or Pepsi or Cola over orange juice. And interestingly, that video has gone down. But going back to the continuous glucose monitors, it's now been added. He added an asterisk saying, if you have an eating disorder or difficult relationship with food, make sure not to use this and everything. But he only did it much, much later on.
Damage is already done.
Yeah.
It's a problem.
Yeah.
I understand that there is a desire from the general population to look at preventative healthcare and to support their health in the best ways that they can. The problem is there are now thousands of companies looking to profit from that fear that people have. And as we mentioned before, it's hard to get a GP appointment even if you're really sick, let alone if you just want to go and have a few blood tests just to make sure everything's okay, or have your blood pressure checked and things like that. That sort of service is just not really available now because everyone's so stretched. And so people are looking to commercial companies to think about their health. And it's great that people are engaged with their health, but when the services that are provided are predatory and causing more harm and there's no regulation, we've got a real issue.
Yeah, I think you explained it so well, that word predatory. It's trying to like prey on like very vulnerable people who are like desperate, just trying to like, they're just so emotionally vulnerable because they've tried literally everything.
Yeah. And health anxiety is real. Health anxiety is a massive issue. And when you have health anxiety, very often the more data you have, the more anxious you actually feel. And the more data you have, the less you know what to do, and the more more confused you are about everything. And it's never enough. My experience of patients who live with health anxiety and start going down the commercial testing route is you have one thing, then you take another thing, then you do another thing. You never feel like you've got enough information. And these companies aren't really set up with the right aftercare and the right support to tell you what to do and what to act on and what not to act on. I had a really interesting conversation with a group of colorectal surgeons recently where we were talking about the case scenario where somebody has a load of blood tests done by a commercial company and there's a flag in there for a potential cancer marker. Patient goes to GP and says, hey, I've got this cancer marker. GP and refers on. The referrer then does all the scans under the sun, can't find anything. What's going to happen to that patient? What's that person supposed to do? Just have CT scans every 6 months, have more blood tests every 6 months. The commercial company's got no responsibility for that patient at all. They're just going to go, well, that's what we found and that's what we are telling you. And yet this patient now has to live with the anxiety of regular monitoring or the anxiety of not having any treatment for something that they believe might be cancer. And that's what we're living with. It's a dangerous thing for people. The more you know is not necessarily the better,
Yeah, sometimes ignorance is bliss.
Yeah, absolutely.
As dietitians with our knowledge, I'm surprised with how self-assured we are. I think it's because we know the evidence, we know what's right, what's wrong, so we can't like fall into these pitfalls, but we just have to educate so many people. Going back from working from the cancer bit, so you mentioned earlier about the rise of colorectal cancers in much younger people. Do you think, because this is what I think, do you think it's related to the rise in people jumping onto the carnivore diet?
Look, I think that the carnivore diet has a lot to answer for, and I think we're going to see a huge spike in colorectal cancers among the age group of people who are starting to adopt that as a lifestyle, in inverted commas. I think the bottom's going to fall out of that whole diet fairly quickly, because I think there's going to be some big, health scares around it. I saw someone posting the other day saying, oh, I'm on the carnivore diet and now my cholesterol's gone right up. I must be doing something wrong. What am I doing wrong? And, and just think, no, you're not doing anything wrong. Well, you're doing everything wrong.
You're doing everything wrong.
Carnivore diet's caused that. They're like, do I need more fat? What do I need to do? No, you need to not be on a carnivore diet. It's the worst thing you could possibly do. I think that it certainly has an impact. I suspect that there is a huge role for the microbiome in the increase in colorectal cancers amongst young people. I suspect there's a huge role for HPV, so the virus that also causes cervical cancer. That's certainly causing some rectal cancers in much younger people. And I think ultra processed foods and all the other things that we do these days are contributing to these kinds of problems. It's really sad to see, but I hope we'll learn from it quickly and change things quickly, because when I was working in NHS, colorectal cancer was almost exclusively in people in their 50s and 60s and 70s. Now we saw very few cases in their 20s and 30s, but now my understanding is that's much higher.
Jumping onto a different person, I'm going to name call other people just so other people know and they're aware. What do you think of, I don't know if you've heard of him, Eddie Abu?
Well, interesting you should say that. I think next week I'm recording a BBC podcast with him.
With him? Yeah. Oh, that's going to be really interesting.
As an opponent, I guess.
Okay.
Which I'm slightly worried about, because from my understanding of him, he's not someone who's going to listen and take on board the things I've got to say. I think I'm probably going to get shouted at and sworn at. he is causing huge problems for people.
Mm.
Things that I've been noting down are things like demonizing fruit, so saying people shouldn't be eating fruit, people shouldn't be eating. Obviously, yeah, like he's saying people should cut down on ultra processed foods. Great idea. I don't disagree with that.
Mhm.
The way that he's going about demonizing foods that causes lots of the problems that you know all too well about. Yeah, telling everyone to eat red meat every day, going against all government guidelines, telling everyone that no one should have dairy, again, against all government guidelines. For some reason, this man thinks that he knows better than every researcher and every World Health Organization, recommendation in the world. And yeah, I mean, you can't reason with unreasonable people, right? That's a interesting and important point that I'm going to have to get my head around. But he's a problem. He's definitely a big problem in this space at the moment.
So how long is the podcast gonna be? Because I'm really, really looking forward to that. It's a perfect match.
I don't know about that, Jonathan. I'm scared. I don't know. I think I think we're recording next week now. It's supposed to be tomorrow, but I think we're recording next week now, and I think it's only quite a relatively short one, so we'll see.
Yeah, because I think he has a cooking show now.
Oh God.
Because yeah, he popped up in one of my YouTube recommendations. I was like, what? Like he has a cooking show, and he just created this quite carnivore meal that contained like lots of eggs, lots of meat, avocado. Basically, he just really thrives on a keto lifestyle.
Yeah, essentially, but he doesn't want to call it
Yeah.
that. He wants it to be, set up as his own thing. The thing I
Yeah.
really worry about for him, is he's currently working with a celebrity who I'm not going to name because it's her, it's personal, and it's public, but I don't want to feed into the narrative. But she's clearly somebody who struggled with her relationship with food for years and years and years, and very publicly so. And now he's on board trying to help her, and that just makes me so worried for her, because inevitably she's going to follow this diet for a short period of time, however long she can, and then she's going to feel like a massive failure, and he's going to shame her and make her feel awful. And the way, his narratives around food are going to make her feel even worse and even sadder that she can't manage her relationship with food. And that lady, in my opinion, needs help from an eating disorder specialist, not who's going to shame her and make her feel worse about herself.
If I'm correct, does her first name begin with a G?
Yeah.
Yes, okay, we're thinking the same thing.
Yeah.
Oh, it's such a terrible thing. And like there's a saying that if you're passionate about anything, anyone will believe you. If you start like swearing, anyone will believe you. If you want to be popular in the internet, you just have to start swearing, and you could literally say like pigs are flying, and then like, oh, blah 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 blah, and then they'll believe you.
Yeah. And it's interesting because I noticed from my content that actually the stuff where I post just general educational things about, bowel habits, stuff like that, doesn't really do so well. The stuff where I'm controversial and say things, I posted one the other day saying greens powders are just ultra processed vegetables. It's done really well. Like, stuff where you're negative, where I'm negative about things, does really well. The stuff where I'm positive about things and just trying to generally educate, Instagram does not promote that in any way, or encourage the sharing of that, basically, which is a shame.
Yeah, I mean, in the past, you became friends with Jamie Alderton, if you could remember that. So
long time
I'm
ago.
sure, I'm sure you could like bring something similar to Eddie of you.
Yeah, that's my plan. That's my plan, and also just to be comfortable with the fact that he's not going to accept anything that I say.
Are you prepared that because he has quite a number of zealots, lack of a better word, are you prepared that they probably might like try to attack you?
Oh, come. I don't care. I don't care. It's one of those, like, I don't know. I think people who are indoctrinated by somebody like him, they're never going to be somebody that well, maybe one day when they really mess up their bodies, they'll come back around and come and see me. But ultimately, they're not people that I've got any concerns about.
But who knows? Like some people might have like really bad bloating, really like bloody stools following his kind of diet, and then you might like raise awareness of
which would be
that,
great.
and then they'll just head to you for proper help.
I hope so.
I
I hope so.
Yeah. Oh, that's amazing. So I'd just like to end this podcast with well, first of all, Sophie, where can people find you if they want to work with you?
Yeah, so I'm at Sophie Dietitian on all social media platforms. My business is City Dietitian, so citydietitians.co.uk. And if you Google my name, you'll find the Channel 4 show, you'll find all the other stuff, and feel free to connect with me anywhere that you are interested.
Highly recommend watching the show. It's really, really good.
Thank you.
And there's a normal routine with my podcast that the previous guest would ask the current guest, which is you,
Nice.
any kind of question. So the previous guest was from Wholesome Chick Nutrition. She wanted to ask you, what book are you currently reading, Sophie?
Oh, good question. I wish I had a good answer for that, Jonathan. I really struggle with reading. I'm really dyslexic.
Mhm.
So I pick up things and I put them down again, and I listen to a lot of audiobooks. And I'm currently listening to one which I can't remember the name of, but it's about I was in Milan at a conference a couple of weeks ago, and I downloaded an audiobook about an adventure in Milan, which I'm really enjoying.
Is that what it's called? An Adventure in
No, I can't
Milan?
remember what it's called. I could look, but it would be boring.
Is it is it an educational book or more of a fictional?
No, it's a fiction book. I find,
Oh,
but for the majority of my non-working life, when I'm walking the dog or whatever, I find it very useful to listen to fiction, podcasts, things that I enjoy, things that are not work related, because I've just got to switch my brain off at some point. Otherwise, I can't
oh,
focus.
oh, absolutely. Especially when like things like Eddie Abuse
I know.
spewing stuff, it's like you can't escape it.
Exactly.
All right. And what question would you want to ask the next guest?
Oh, I don't know if I'm very good at this.
Could literally be anything.
Let's say something like, what would your younger self like to tell your older self about your relationship with food? Let me see if I can word that better.
I think you already worded it perfectly.
Yeah, do you think that's okay? Do you get it?
Yeah.
Okay,
Yeah.
great.
Easy to pick up.
Perfect.
All right. Well, thanks, Sophie, for just coming
You're
along to the
so welcome. It's
podcast.
really nice to see you.
Yeah.
Good luck with everything.
Same thing with you. Yeah, I hope everything goes well. And I'm
Let
sure
me know how it goes
you'll
with
win.
Eddie.
Yeah, get the boxing gloves out.
Oh God. I just think, I'm preparing to say I want to ask him things like, sorry, I'm conscious you're still recording, but I want to
No,
ask
that's
him.
completely fine. Yeah.
I'm conscious I want to ask him things like, how do you feel when people completely debunk what you're saying using research? Like, how do you feel about that? Because I want to understand what I want to say to him. When you say they are lying to you, who is this they? Like, who are you referring
Yeah,
to?
he says it all the time.
Who are they? Who are they, Eddie?
Yeah.
Who's after you?
Do
Anyway,
you know his background?
I know he's a bodybuilder, and I also know that he used to be a psychiatric nurse.
Yeah,
Which
he's a
makes me,
psychiatric nurse.
yeah, which makes me cross because of the damage he's doing to people's relationship with food. Like, I don't understand how he can
Yeah.
think that's okay and just dismiss those concerns, really.
So that's what really surprised me, because surely he should know that people like struggle with their relationship with food, and maybe he's come across patients with eating disorders here and there,
Yeah.
which is really, really interesting.
Yeah.
It's
And
like,
also surely he should understand that, like, excuse me, like, brain health and carbohydrates are very closely related.
And
Stop telling people to stop eating carbs.
and probably if he was like mostly an NHS based psychiatric nurse, he must have come across giving patients ONS or nutritional supplements
Yeah,
in some
surely.
form.
Yeah.
So what's happened over there?
Lost his mind. All
Yeah.
steroids.
Oh, you said it now. You should say that.
We'll see. We'll see how bad
Yeah.
he gets.
All right.